Hello and welcome. My name is Patrick Thoya, and our discussion will be on cardiac tamponade. So before I start, if you're new to this channel, kindly subscribe so that you can keep getting the updated videos from my channel. What happens here in cardiac tamponade is you have the pericardial sac filled with blood. And what happens is as blood is accumulating inside that sac, the end result is the heart will end up getting compressed and getting obstructed from doing its normal job of pumping. And the easiest way to diagnose this condition in the pre-hospital setting is when you have this patient, you want to look for backslide. And in the backslide, you're looking for three conditions or symptoms, signs and symptoms here. The first one being jugular vein distension. The reason why we have the JVD or jugular vein distension is because this is as a result of the heart is being obstructed from pumping. So what happens is the cardiac output is compromised. So you have a situation where there's much blood coming from the blood vessel, from the veins to the heart, but less is going out from the heart. So as a result, you have much blood going back to the vein, condition that we say we have a venous recurrence, and that's how the JVD normally present itself. Something that you need to remember is in trauma, you can have a situation where you have multiple injuries, and if this happens that this person has cardiac tamponade and this patient has been bleeding, you realize that the JVD might not present because of the low BP. The second sign and symptom is that on auscultation you pick muffled heart sound. One thing that you need to remember is in the pre-hospital, the environment might not be conducive. There's a lot of noise from the bystanders. So you realize that when you auscultate in the field, you might miss this. That is, you have to rely on other symptoms. The third sign in the backslide is reduced blood pressure. Since the heart contractions are reduced, you have a situation where you have less cardiac output, and that's what is causing the low blood pressure. So in trauma, one of the things that you should pick is if this patient is attached to the monitor, or you're using the digital BP machine, during inspiration, you may pick that there's a sudden drop of the systolic blood pressure by 10. When you see that condition, you can highly suspect cardiac tamponade. So to add on the signs and symptoms is that you can have the patient presenting with tachycardia. Heart is trying to compensate so that it can meet the demand of oxygen. One of the easiest way to know that you're dealing with cardiac tamponade, keep observing the JVD. Two things. In breathing in, you want to check for an increased JVD, and also when you observe the BP, the systolic blood pressure, during the same time, it can be dropping by 10. That's a clear sign that tells you that you're dealing with cardiac arrest. When you have a PEA, that is a pulseless electric activity, and you've ruled out that there's no hypovolemia and tension pneumothorax is out, cardiac tamponade can be highly suspected. Management of cardiac tamponade in the field is highly supportive. Your job as a paramedic or an EMT, you need to recognize this, and what you need to do is rapid transport as you're supporting the ABCs, giving high flow of fluids. You want to have all the vitals and manage them accordingly. So one of the special considerations that you want to have when you suspect your patient has cardiac tamponade is when the patient gets into cardiac arrest. In the pre-hospital, when you have a patient who is in cardiac arrest, what you want to do is you want to stop the ambulance and you start the CPR. And when this person comes back, then you transport the patient. But for the cardiac tamponade, you might not consider stopping the vehicle, because you need to understand that whatever is stopping that heart is that fluid that is surrounding the heart. So even if you do the CPR the whole day and there's no one who will come and remove that fluid, then the chances of bringing this person back is zero. So what you want to do is in case of cardiac arrest, you might decide to do the resuscitation as you're moving to the facility, especially when you're just next to the facility. Or you can do arrangement and call for backup. You can have a doctor to come and do the pericarditis to remove that fluid. Then that should be the best option. Thank you for watching. If you've been interested by this video, kindly don't fail to subscribe for more videos to come. Thank you very much, and keep following my channel for more updates.